We are here today to talk about the topic of genomics as it relates to nursing. Specifically, we are going to explain our teaching plan that will educate our peers regarding the genomic objective that Healthy People 2020 has set. Before taking a look at the Healthy People 2020 objectives, we first will highlight our specific objectives for this presentation. First, we want to educate our audience on what the Healthy People 2020 goal is as it relates to genomics. Second, we will present evidence-based research related to genetic testing in breast cancer. This will look at the importance of getting tested, along with who should get tested, what is specifically getting tested, and how the testing works. And finally, we are going to look into what nurses should know about genomics in healthcare. This will highlight how it relates to practice and the minimum knowledge nurses must know. Let's take a look into what Healthy People 2020 is. Healthy People 2020 has created 10-year national objectives for improving the health of all Americans. They have done this by setting specific goals and objectives designed to guide national health promotion and disease prevention efforts. Released by the U.S. Department of Health and Human Services each decade, Healthy People reflects the idea that setting objectives and providing science-based benchmarks to track and monitor progress can motivate and focus action. Healthy People 2020 represents the fourth generation of this initiative, building on the foundation of 3 decades of work. The vision, a society in which all people live long, healthy lives. For our presentation, we are looking at the goal of genomics. This was a new goal added to the Healthy People 2020 from the growing trend of genomics and genetic testing impacting healthcare. As Healthy People 2020 states, the overall goal for genomics is to improve health and prevent harm through valid and useful genomic tools in clinical and public health practices. Within that goal, Healthy People 2020 focused on 2 objectives related to genomics. We are going to solely focus on how genomics plays a role in breast cancer. The overall objective is to increase the proportion of women with a family history of breast and/or ovarian cancer who receive genetic counseling. So now let's look into genomics in healthcare. This overall goal within genomics in medicine comes from the increasing scientific evidence supporting how the use of genetic testing and family health history can guide preventative and medical interventions that will increase the well-being of each individual. It is important to understand the overall principle of genomics as nurses, as it will guide our care with each individual getting tested. The National Humane Genome Research Institute defines genomic medicine as an emerging medical discipline that involves using genomic information about an individual as part of their clinical care. This would be seen with diagnostic tests or decision-making based on results. They go on to say, oncology in particular is at the leading edge of incorporating genomics as diagnostics for genetic and genomic markers are increasingly included in cancer screenings and to guide tailored treatment strategies. For us as nurses, it is vital that we understand how genomics can impact the care of each individual. As we continue to assess each patient, it is our duty to identify who would be a good candidate for getting tested and then educate each client on the next steps. We also should be aware of the implications for when the genetic test results come back and how to customize care for each of our patients. As nurses, we are constantly always further educating ourselves, so we should be familiar with the current research being done on each topic as it relates to Healthy People 2020. Here's the Healthy People 2020 page detailing the genomics overview. It also looks at the objectives, interventions and resources, and the national snapshots. This image shows the national snapshot for the genomics objective. This simple image shows the enormous success of how genetic testing has been implemented for breast cancer. As you can see on the bottom line, the initial goal was at a baseline of 34.6. As of to date, the proportion of women with a family health history of breast or ovarian cancer who have received genetic counseling increased from 34.6 to 52.9 from 2005 to 2010. This statistic might reflect the Affordable Care Act now covering genetic counseling as a preventative service, which means that there is no cost for women who have a family health history to get tested. Healthy People 2030 will now set the baseline to 73.7. Though this number might seem high, we as nurses are at the forefront of making this statistic a reality. Now, let's look at the importance of getting tested with a genetic predisposition to breast cancer.
Why is this Healthy People 2020 goal so important? It is important because breast cancer has become the most common type of malignancy among American women. It has also become the second most common cause of death among women. According to the American Cancer Society, there is a 12% chance that an American woman will develop breast cancer in her lifetime. That is approximately one diagnosis for every 8 women. That number becomes more devastating in the population of women with the BRCA1 or 2 gene mutation. 1 in 3 of those women who have the mutation will be diagnosed in their lifetime. In this slide, we have included a visual aid displaying the mortality of females with breast cancer from 2006 to 2010. As you can see, the rates are very significant. Displayed here is a visual representation of the increased risk of cancer those with a BRCA mutation have compared to those in the general population. According to Lynch, Snyder, and Wang, identifying the genetic predisposition increasing the susceptibility to the disease is the first step to understanding the genetic basis of familial breast cancer, which can potentially guide specific targets for clinical diagnosis, prognosis, early detection, and treatment. By continuing to use genomics to test for mutations, data can be collected on potential patterns in the course of the disease and potentially successful treatment options. The earlier that a BRCA gene mutation is identified, the faster interventions can be initiated. This will lead to reducing the mortality rate and increasing successful outcomes. By detecting the gene mutation early, women can be proactive with regular screenings such as mammograms and monthly self-breast exams. Regular screenings will increase the chances of detecting malignancies in their early stages. Detecting malignancies in earlier stages improves long-term survival rates. Also, identifying the gene mutation early can allow the patient to make prophylactic decisions, increasing their sense of control. A prophylactic double mastectomy reduces the risk of breast cancer over 90%. Angelina Jolie opted to have a double mastectomy, pioneering the conversation about breast cancer's association with genomics. There are also prophylactic medications that can be used, such as tamoxifen. Testing is also important because it can act as a form of patient advocacy. Nurses have a huge role in advocating for those who may benefit from testing, as well as those who have tested positive for mutations. Nurses can assist in detecting risk factors of patients that show potential benefit from genomic testing. Nurses can also help those with positive mutation results by teaching and assisting them in prevention methods, including regular screenings as well as lifestyle changes. Screenings for those who have BRCA mutations may be modified to be performed at an earlier age or at more frequent intervals. Lifestyle changes that could benefit at-risk clients include eating healthy foods low in fat, abstaining from drugs, alcohol, and tobacco, and exercising regularly.
Genomic testing should be considered for those whose individual or family history suggests the possible presence of the BRCA1 or BRCA2 mutation that is associated with breast or ovarian cancer. The family history risk factors that are associated with an increased likelihood of having BRCA1 or BRCA2 mutations include breast cancer diagnosed before 50 years old, cancer in both breasts in the same woman, both breast and ovarian cancers in the same woman or family, multiple breast cancers, 2 or more primary types of BRCA1 or BRCA2 related cancers in a single family member, cases of male breast cancer or Ashkenazi Jewish ethnicity. In addition to detecting cancer, genomics is also used to monitor the progression as well. Genomics can detect the harmful hereditary breast cancer mutations called BRCA1 and BRCA2, which allows them to provide an estimation for their risk of developing breast cancer. Evidence-based practice suggests that women and men with a high-risk family history of breast or ovarian cancer can greatly benefit from receiving these genetic tests. This genetic testing will look at BRCA1 and BRCA2, and if these mutations are positive, then the patient can be provided not only with an estimation of the risk for developing breast cancer, but it also allows for the early detection of cancer as well. BRCA1 and BRCA2 are human genes that produce tumor suppressor proteins. These proteins help repair damaged DNA and maintain genomic stability. Pathogenic mutations or alterations in these two genes cause DNA damage not to be repaired, which leads to the cells being more likely to develop additional alterations, such as cancer. If a woman has a pathological BRCA1 or BRCA2, then they have up to an 80% chance of developing breast cancer by the age of 70 years old. There are also specific inherited mutations in BRCA1 and BRCA2 that increase the risk of female breast and ovarian cancers and have been associated with increased risks of several additional types of cancer. BRCA1 and BRCA2 mutations account for about 20 to 25% of hereditary breast cancers. For women who have BRCA1 or 2 mutations, several interventions may reduce their risk of cancer, including surgery, medications, and earlier, more frequent and intensive screenings. The strength of evidence varies across the different interventions, but the evidence is strongest for the benefit of surgical interventions, which potentially reduces breast cancer risks by 85% or more and ovarian cancer risks by 69% or more. If a patient has the risk factors for breast cancer, then their healthcare team may recommend a few different options to get the genetic testing. A patient can use color genetic testing, which is an at-home option for people, or they can be referred to a genetic counselor. In order to have a genetic test performed, the patient must give a sample of DNA from their hair, blood, amniotic fluid, skin, or saliva. As stated in the previous slide, a patient can choose color genetic testing, which is a new at-home option. This test has to be physician-ordered based off of one's risk factors. Once the test is received, the person will send back a test tube of their saliva to receive genetic counseling based off of their results. The physician may order a hereditary cancer test, which analyzes 30 different types of cancer, the BRCA test, which is associated with breast and ovarian cancer, or the hereditary high cholesterol test. This is a new option that offers easy, accessible, and affordable clinical-grade genetic testing.
In the previous slides, we learned about Healthy People 2020's initiative about genomic testing in regards to cancer. We have also learned about who gets these tests and what gets tested, and briefly touched on the nursing implications. But now that we have all this information, what is the nurse's role in genomics medicine? How do we present this to a client? How much does a client want to know, or even need to know? How does this information impact a client presently and future lifetime decisions? Am I educated enough to present the results of this genomic testing? As nurses, how do we manage this advancing field? And who sets the parameters of nursing care? And what do I need to know? What do we do with all this information? Fortunately, we have support. The American Nursing Association Center for Code of Ethics and Human Rights has been participating in efforts to assure nurses are prepared to provide competent nursing care when faced with genetic and genomic healthcare concerns. The ANA publishes the Essentials of Genetic and Genomic Nursing Competencies, Curricula Guidelines, and Outcome Indicators, which cover all areas of nursing practice in relation to genomics. The American Association of Colleges of Nursing also have a competencies list that includes specific skills nurses should obtain in regards to genetics and genomics. As a provider of care, some of these competencies include informing, teaching, educating, and explaining core concepts of genomics. It is important to keep the information simple and use layman's terms. When communicating genetic and genomic results, it is important to be non-judgmental, sensitive to individual beliefs, and we need to be able to discuss the possible implications of these results and how they will be managed and possibly affect lifestyle, family dynamics, and future lifestyle choices. If a patient finds out they have the BRCA gene mutation and are more susceptible to cancer, this information can be devastating. It is very important as nurses that we understand how significant and life-changing this information really is. The nurse's role as a manager of care within genomics is about collaborating with different healthcare team members. One may find themselves collaborating with the genetics testing center, genetics counselors, oncologists, primary care physicians, and pharmacists. As a manager of care, again, we need to think about family implications and may also need to collaborate with different members of the family because of the far-reaching effects this hereditary mutation gene can have within the family. Finally, as a member within the profession, continuing nursing education with genomics testing and practice is essential. We need to keep up to date on nursing standards, identify facilities policy and procedures pertaining to genomics. Another component is identifying and understanding the ethics and legal implications related to genomics. Some ethical considerations would be, what age do we start testing? Does a relative have the right to know the results? Can prisoners be tested? Can I mention to a patient about testing? Just thinking about genomics and how it integrates into nursing practice opens up a large amount of ethical and legal concerns, and we need to be mindful. Genetics and genomics is now being integrated into nursing education. The brunt of this large task falls on the shoulders of nurse educators. According to a research study published in the Journal of Nursing Education and Practice, the gap between nurses' genetic aptitude and genomic research has gradually expanded over the last decade. This leads to nurse educators feeling ill-prepared and undereducated to teach the subject. Nurse educators in general understand a small amount of genetic information, but current nursing faculty receive little formal genetic education and as such may feel underprepared to teach a genetic course. The gap between faculty knowledge and integration of genetic and genomic content into curricula continues today. Yet, for nurse faculty to educate their students, they must first educate themselves. It is our duty as nurses to be responsible and understand the scope of our practice. There are many research articles and publications that aid nurses, nurse educators, and seasoned nurses to achieve the minimum level of competency needed for nursing genomics. Included in this slide is a list of resources that will answer all of your questions pertaining to nursing and genomics.
In review, we learned about the Healthy People 2020 goal to incorporate genomics testing regarding breast cancer. This presentation highlighted how Healthy People 2020 has reached their goal and their plan to continue to reconstruct this goal for Healthy People 2030.
We also provided statistics and evidence-based research about why it is important to be tested and who would need to be tested.
And finally, we talked about some skills and minimum knowledge that a nurse needs to know about genomics. We also included a comprehensive resource list to further your spirit of inquiry.
We hope the information presented today will further guide how you implement your nursing practice in relation to genomics in the healthcare field.